My name is Steve Long, and I'm the President and CEO of Hancock Health here in Greenfield. We are a full-service community hospital that provides everything from emergency medicine care to neonatal care, childbirth care. We do some trauma surgery, we do orthopedic surgery, we do cancer care, we have an amazing radiation oncology and medical oncology. We basically do everything except open up your head and open up your heart. We do everything else here. Facilities, all the different things we do, monitoring is incredibly important. Everything from the temperatures in refrigerators, right? We need to know that medications and even food are kept at the right temperatures. In the past, that was all a very manual system. Someone had to check the temperature every day and write it down. And if something happened when no one was watching, we didn't know. There was no alarming. So before we had many of these alarms, something would happen, we would lose many thousands of dollars worth of pharmaceuticals. And then you say, wow, we really wish we would have had some kind of monitoring that would have been watching that. So usually what happens is you identify an opportunity because something bad happens, and then you put the monitoring system into place. The bigger issue though is the safety factor, is that it's difficult to put a number to safety. So let's suppose that we have a medication in a refrigerator that goes out of range and that medication is spoiled in some way. Then it not only can be effective, it might also be dangerous. There have been some occasions, I can think of some that have happened in the building, usually in relation to drugs, because that is the thing that is most easily harmed, that the monitors have picked it up and the alarms have registered it, and then someone has intervened. And some of these things are just obvious though. If you are monitoring the temperature in refrigerators that hold medications, and you have to pay a person to go around and do that every day, that's a pretty easy math problem, right? Because you invest in the technology and the ongoing expense is really low compared to a labor cost. Well, let me say that I cannot imagine life without monitoring and alarming. And I could see that without Sonicu, what we would have is all different systems that we're monitoring all separately and we're alarming all separately, and it would be very confusing. And in some cases it still is, because Sonicu doesn't do everything. But the ability to have one company that we work with, one system that can monitor all of that, and one method to track to be able to ensure that the alarms happen has made it much easier, much more efficient than what we would otherwise have. So we have many departments, as you might imagine, in the hospital that rely on monitoring technology. Pharmacy is unique in that it uses many of the different modalities for monitoring, ranging from the humidity in the IV mixing rooms to the temperature in the refrigerators to all kinds of things. So someone like our pharmacy director might have multiple different systems that we're trying to notify him of things that were happening. Whereas now much of that is all centralized via Sonicu, it's all wireless, and there is a single point of entry for the alarms. And so that gives us a great deal of confidence that we are monitoring the environment appropriately, that we are monitoring it continuously, and that we can alarm and notify someone that can take action at a moment's notice. At the core, we are people taking care of people. That will never change, but technology helps us and assists us in doing a much better job than we used to be able to do. I can't imagine a life without alarming and monitoring of some kind. I don't know how we would do it.